Hi everyone, welcome to LAMP Clinics featuring Common Cold, presented by LAMP AccuWellness Foundation Inc. Diagnostic principles for exterior pattern and concept of warm disease when peeing. Exterior pattern is a group of symptoms caused by the invasion of the skin, interstices and pores, channels and collaterals by external pathogenic factors. Characteristic symptoms include concurrent fever and aversion to cold, nasal obstruction and discharge, headache or aching around the body, cough, and sore throat. Tongue coating is thin and pulse is floating. The crucial factors in diagnosis are the simultaneous occurrence of fever and aversion to cold, thin tongue coating, and floating pulse. The basic pathological change is that the pathogenic factors remain on the body surface and confine the protective chi to a deeper level in the body. The physiological function of protective chi or defensive chi, which pertains to yang, is to warm the body surface. And when the pathogenic factors prevent it from reaching this area, the superficial tissues are not warmed and the patient develops an aversion to cold. In such cases, the protective chi has not been weakened but merely trapped, and it therefore struggles to reach the surface. This struggle produces heat, which manifests in fever. Pathogenic factors on the surface block the channels, particularly the collaterals, and also affect the lung chi, resulting in general aching, nasal obstruction, sore throat, and cough. Tongue coating remains thin and the pulse floating because the pathogenic factors are only on the surface and have not affected the function of the organs. What is the difference between aversion to cold and feeling cold? A patient with an aversion to cold has a subjective feeling of cold and may shiver, but the symptoms are not relieved by putting on more clothing. It is always accompanied by fever. This is typical of an exterior pattern. Some individuals always have a feeling of being cold. They neither shiver nor have a fever, but tend to wear more clothes than most people consider appropriate. The extra clothing relieves their feeling of cold. This is a symptom of yang deficiency, which is an interior pattern. The yang qi has the function of warming the body. Thus, when it is deficient, the patient naturally feels cold. The extra clothing cuts down heat loss from the body surface, and the symptom of feeling cold thus improves. There is no fever because the body temperature tends to be below normal. When a patient says that he feels cold, it is thus very important to elicit by questioning the precise nature of their symptoms. Subjective cold, not relieved by extra clothes, fever present, will mean aversion to cold, perhaps shivers, and this is an exterior pattern. Protective chi is confined and the body surface is not warmed. Subjective cold relieved by warm clothes, no fever. The patient always feels cold, so this is an interior pattern, and this will lead to yang deficiency. The whole body is cold. How does one distinguish between different external pathogenic factors? Invasion of the body by pathogenic factors is the cause of exterior patterns, And in the clinical situation, the symptoms must be analyzed in order to determine which factors are present. There are four common patterns: wind cold, wind heat, dampness, and dryness. Common cold and influenza are viral infections of the upper respiratory tract. The common cold may be caused by a variety of viruses, including the adenovirus, echovirus, in particular type 11 or E11 and type 20, E20, parainfluenza virus and rhinovirus. Influenza may be caused by the influenza viruses A, B, or C. In Chinese medicine, both the common cold and influenza correspond to invasions of exterior wind, which may manifest as wind cold, wind heat, wind damp heat, or wind dry heat. However, wind cold and wind heat are the two most common types, and broadly speaking, they are also the two types that encompass most exterior manifestations. External wind invades the lungs' defensive Qi portion, the exterior of the body, causing exterior symptoms such as aversion to cold, fever, occipital stiffness, headache, and a floating pulse. External wind may be combined with cold, heat, dampness, dryness, and water. Exterior wind penetrates via the skin and interferes with the circulation of defensive Qi in the space between skin and muscles. Since defensive Qi warms the muscles, when its circulation is impaired by wind, the person feels chilly and has aversion to cold. Aversion to cold or wind is a characteristic and essential symptom of invasion of exterior wind, and consists not only in feeling cold and shivering, but also in a reluctance to go outside in the cold. This aversion to cold is not relieved by covering oneself. The lungs control the spreading of defensive Qi or Wei Qi in the exterior of the body, and also the opening and closing of the pores. The presence of wind in the space between skin and muscles interferes with the diffusing and descending of lung Qi and causes sneezing and possibly coughing. The impairment of the diffusing and descending of lung Qi prevents the spreading and descending of lung fluids, resulting in a runny nose with profuse white discharge. The fight between the pathogenic wind and defensive Qi in the skin and muscles may cause fever, which is not necessarily an actual fever, but an objective hot feeling of the patient's body on palpation. It is the simultaneous occurrence of aversion to cold, which is subjective, and emission of heat, which is fever, objective, that marks an invasion of external wind. Wind attacks the most superficial channels first, which are the greater yang or taiyang channels, small intestine and bladder, and obstructs the circulation of defensive Qi within them. This causes stiffness and pain along these channels, and particularly in the back of the neck. Wind attacks the top part of the body and often lodges in the throat, causing an itchy sensation in the throat. If wind combines with cold, with a prevalence of the latter, there will be no sweating because cold contracts the pores. The pulse will be tight, This corresponds to attack of cold of the greater yang stage within the 6 stages. This is more likely to happen when a person has a relatively strong constitution and a tendency to excess patterns. Then the body's defensive qi reacts strongly, the pores will be closed, and there will be no sweating. This is an exterior full pattern. If the cold is not so prevalent, but wind predominates, the pores are open. The person sweats slightly, and the pulse will be slow. This corresponds to the attack of wind pattern of the greater yang stage within the 6 stages. This is more likely to happen to a person with a relatively weak constitution and a tendency to deficiency patterns. Then the nutritive qi, yin qi, is weak. The pores are open and there will be slight sweating. This is an exterior empty pattern. With the invasion of exterior wind, defensive qi reacts by rushing to the exterior of the body, and this is reflected on the pulse, which becomes more superficial, the floating pulse. External wind combines with other pathogenic factors and primarily cold, heat, dampness, and water. Therefore, we will outline the clinical manifestation of 5 types of exterior wind: wind cold, wind heat, wind dampness, wind dryness, and wind water. Wind cold. Patient will have aversion to cold, sneezing, cough, runny nose with white watery mucus, fever, severe occipital stiffness and ache, no sweating, no thirst, floating tight pulse, tongue body color unchanged, thin white coating. Wind heat. Aversion to cold, fever, sneezing, cough, runny nose with slightly yellow mucus, occipital stiffness and ache, slight sweating, itchy throat, sore throat, swollen tonsils, thirst, floating rapid pulse, tongue body red on the tip or sides, thin white coating. Wind dampness. Aversion to cold, fever, swollen neck glands, nausea, sweating, occipital stiffness, body aches, muscle ache, feeling of heaviness of the body, swollen joints, floating slippery pulse. Wind dryness. Fever, slight aversion to cold, slight sweating, dry skin, nose, mouth and throat, dry cough, sore throat, dry tongue with thin white coating, floating rapid pulse. Wind water. Aversion to cold, fever, edema especially on the face, swollen face and eyes, cough with profuse white and watery mucus, sweating, no thirst, floating pulse. The discussion of cold-induced diseases, Sang-Han Lun, by Zhang Zhongqing, provided the earliest framework for the diagnosis and treatment of diseases from exterior wind cold. Although this famous classic does also discuss invasions of wind heat and their treatment, a comprehensive theory of exterior diseases from wind heat was not developed until the late 1600s by the School of Warm Diseases, Wenping. The two schools of thought which form the pillars for the diagnosis and treatment of exterior diseases in Chinese medicine are separated by about 15 centuries. They are the school of cold-induced diseases, the school of Sanghan, and the school of warm diseases, Wenping School, which started in the late 1600s and early 1700s. The main advocates of this school were Wu Yuxing, Ye Tianxi, and Wu Tong. The above-mentioned doctors from this school of thought introduced important innovations to the theory of wind in Chinese medicine. The school of warm diseases postulates that some exterior pathogenic factors go beyond the natural characters of wind. They are so virulent and strong that no matter how strong a person's body's qi may be, men, women, and children fall ill by the dozen. For the first time in the history of Chinese medicine, these doctors recognized that some external pathogenic factors are infectious. Previously, it was believed that a person fell ill from an exterior disease because of a relative imbalance between an external pathogenic factor and the body's qi. The doctors of the school of warm diseases, on the contrary, realized that some pathogenic factors, although still falling under the category of wind, are infectious. Indeed, some, called warm epidemic pathogenic factor, the Wen-yi, are so infectious that entire communities fall ill. A further innovative idea stemming from this school was that the pathogenic factors causing warm diseases, all of them falling under the category of wind heat, enter via the nose and mouth rather than via the skin, as happens for wind cold. The essential characteristics of warm diseases are therefore as follows. They manifest with the general symptoms and signs of wind heat in the early stages. Wind heat is intended here in a broad sense, as it may also manifest as damp heat, summer heat, winter heat, spring heat, and dry heat. There is always a fever. They are infectious. The wind heat penetrates via the nose and mouth. The pathogenic factor is particularly strong. Thus, although all pathogenic factors contemplated by the school of warm diseases fall under the broad definition of wind heat, not all diseases caused by wind heat are warm diseases. Some of the exterior diseases that start with symptoms of wind heat are warm diseases with all the above-mentioned characteristics, and some are not. Examples of warm diseases are measles, chickenpox, German measles, poliomyelitis, smallpox, scarlet fever, whooping cough, and meningitis. Examples of wind heat diseases that are not warm diseases are common cold of the wind heat type, influenza, glandular fever, mononucleosis, and any nonspecific upper respiratory infection manifesting with symptoms of wind heat. This is a very important consideration in practice. It is possible to stop diseases from simple wind heat at the early stages. But although true warm diseases may be alleviated in the initial stages, they may not be entirely stopped. In theory, as wind is the pathogenic factor in the early stages of any exterior disease, whether warm disease or not, by releasing the exterior and expelling wind, we may stop any exterior invasion at its beginning. Although this is possible for simple invasions of wind heat, it is not possible for warm diseases. Thus, for example, if a child is infected with the Bordetella pertussis bacterium causing whooping cough, we will not be able to stop the disease completely in its beginning stages. In the initial stages, all exterior diseases manifest with similar symptoms of wind cold or wind heat. And at this point, it is not possible to tell whether the patient is suffering from a simple invasion of wind heat or a warm disease. It is important to treat them according to the principle of treatment of exterior diseases, as even though warm diseases may not be stopped completely in the beginning stage, Chinese medicine can alleviate the symptoms, shorten the course of the disease, and prevent complications. Common cold and influenza are simple invasions of wind that can be stopped in the initial stages. Since common colds and influenza are relatively mild and self-limiting diseases, why does the theory of their diagnosis and treatment have such a prominent place in Chinese medicine? Chinese medicine views these diseases differently from Western medicine, believing that if external wind is allowed to penetrate the interior, it can trigger many different diseases. It is therefore important to eliminate the pathogenic factor as early as possible. Simple invasions of wind heat can be stopped at the initial stage. Warm diseases can be alleviated, their course shortened, and any complications avoided. The treatment of exterior invasions is also important because they can have very serious consequences in children and the elderly. In children, many serious diseases start with symptoms of invasion of wind heat. In the initial stages, one does not know what disease it might be, and it is therefore important to treat the manifestations early. For example, measles, diphtheria, whooping cough, poliomyelitis, acute nephritis, scarlet fever, and meningitis may all manifest with symptoms of wind heat in the beginning stage. In the elderly, exterior wind may easily penetrate the interior, causing bronchitis and pneumonia, which are often fatal in old age. Infection from the common cold or influenza virus takes place through the upper respiratory tract and may occur in any season, but it is more frequent in winter or spring. From the Chinese point of view, they can manifest with symptoms of either wind cold or wind heat. Thank you very much for your attention. See you on our next videos.